Hello, my name is Karan Log, and I'm a cancer specialist, and welcome to Cancer Logic. Right now, I'll actually be talking about cancer prevention. So when we talk about prevention from a medical standpoint, we're actually talking about three different ways to help prevent cancer. So the first one that people think about is actually what we call primary prevention. So the idea behind primary prevention is that we will take steps or there are therapies associated with a condition that will prevent a disease from ever happening. So an easy example is a heart attack. So if my father has a family history of a heart attack or heart disease, then I will actually attempt to prevent that from happening by having a very good diet, exercise, controlling my hypertension, controlling my cholesterol, and hopefully by taking these measures, I will never have a heart attack again. So that is what we call primary prevention. Well, the second part of prevention is actually what we call secondary prevention. So secondary prevention basically means that I have the disease, but I don't have any problems associated with that disease. So that's actually when we talk about mammograms. So mammograms are actually a form of secondary prevention. So when someone has a mammogram, what they're doing and what we're trying to find out is, does the patient have breast cancer? And so again, mammograms do not prevent somebody from developing breast cancer. What they're doing is they're finding it early, or early detection of breast cancer. So they will not have, again, distant spread of the disease, and hopefully will not ever really have any problems from that breast cancer from that point forward. The next step is actually what we call tertiary prevention. So tertiary prevention means that somebody has the disease and they also unfortunately have problems from that disease. And now what we're doing is we're basically preventing further damage from the disease. So that would be when somebody does have a heart attack. So now we're treating them very similarly, where we're, again, putting them on antihypertensives, making sure they're eating well, controlling their diet, and maybe even adding something like aspirin to help prevent further complications from heart disease from happening. But again, they've already had the event and they've already had complication from the event. So now the treatments are aimed at what we call a tertiary prevention. So as you can see, there's multiple facets to prevention and not just the singular aspect that most people think about. So now let's talk about, again, primary prevention for cancer. The unfortunate reality is there aren't a lot of primary preventions for cancer. One of the simplest ones is lung cancer. And the best primary prevention for lung cancer is the avoidance of tobacco and smoking itself. And the avoidance of tobacco and smoking will basically prevent a lot of other cancers. So head and neck cancers are associated with smoking, lung cancer, of course. But we've also seen esophageal, kidney, and bladder cancers all associated with tobacco. So if there was one aspect to primary prevention to prevent cancer from happening, it would be the avoidance of tobacco, whether it's smokeless or chewed tobacco, or, again, smoking. But another primary prevention is actually these vaccines. So the HPV virus has been associated with different diseases, and most commonly now head and neck cancers, and also cervical cancer. So what we're hoping is that by now vaccinating a younger generation of individuals, this will hopefully prevent these individuals or a higher incidence of head and neck and cervical cancers from developing in the future. But another very, very good form of primary prevention is to get a colonoscopy. Recent recommendations have actually decreased the age of screening colonoscopy to the age of 45. But what we're hoping by doing a screening colonoscopy is that if we can actually remove a polyp before it becomes cancerous, then again, that is a great form of primary prevention. But unfortunately, those are the only main forms of primary prevention for cancer that we see. The other forms, the screening modalities that we typically think about, are all unfortunately secondary preventions, where we're detecting disease at an earlier stage to prevent somebody from, again, ultimately having problems from their cancer. So, like I mentioned before, mammograms are a form of secondary prevention. So it's still very important to get your mammograms. And this is something that is actually fairly controversial, where different societies have had different recommendations. The American Society of Clinical Oncology has actually made recommendations for annual mammograms at the age of 40, something that I think it's still important to talk to your providers about. But the U.S. Preventive Task Force has made a recommendation for 50. So again, it is something that I would recommend that you talk to your doctors about, but at least consider it starting at the age of 40. Another form of secondary prevention that has actually been underutilized, I believe, is actually screening for lung cancers. What we actually know about lung cancer is actually the most dangerous form of cancer, where if you combine breast cancer, colon cancers, and prostate cancer deaths, it still actually doesn't reach the number of people who actually pass away from lung cancer on an annual basis. And so the biggest risk factor that we see for lung cancer is, of course, smoking. So there have been studies that looked at high-risk populations. So the way that they looked at high-risk populations is they took what we call pack years. So basically you look at the number of cigarettes you smoked per day, you multiply that by the number of years that you smoked, and you end up with a certain number of pack years. So let's say, for example, you smoked a pack a day, and you did so for about 20 years, then you would have 1 pack a day times 20 years would be 20 pack years. Let's say that you smoked 2 packs a day, and you did that for 15 years. So if you take 2 packs per day times 15 years, you would then have 30 pack years. And what we saw is that patients between the age of 55 and 75 who smoked 30 pack years were at higher risk and would actually be eligible for lung cancer screening with low-dose CAT scans. And so if you do fit the eligibility, so again, 30 pack years, and between the ages of 55 and 75, then I would actually recommend that you speak to your healthcare provider about undergoing a screening low-dose CAT scan to help detect cancer at an earlier phase, lung cancer specifically, and hopefully allow you to get treatments so you won't have any further complications such as death from your lung cancer. And so again, cervical cancer screening, prostate cancer screening are things that can be recommended and discussed with your healthcare provider. And so now when we talk about tertiary prevention, so tertiary prevention is unfortunately when somebody has, again, cancer that is enough to warrant treatments like chemotherapy. So chemotherapy is unfortunately a tertiary form of cancer prevention, where you have the disease, and what we're trying to do is stop distant spread, or again, control the disease if the disease is beyond surgical cure, and that is what we call tertiary prevention. And the unfortunate part about the tertiary prevention, or even chemotherapy, when added to the treatment of cancer, it is definitely not as effective as the other two. So we would still look at primary prevention being the best treatment, followed by secondary prevention, and if you get to a point where you need tertiary prevention like chemotherapy, that becomes the role. So hopefully that kind of clarified the roles and the kind of the medical approaches that we have towards the prevention of cancer. Again, my name is Karn Log, and this is Cancer Logic. Thanks again for watching, and we definitely love your feedback, and we'll always try to create videos based on other questions you have. Again, thanks again for watching. Appreciate your feedback.